Hi, this is Gail reading from the New Bedford Light. It is July 9th, 2026. The first article I will read is from Police and Courts. The title is Only 24% of New Bedford shot spotter alerts confirmed as gunshots. The city has dropped the gunshot listening system, citing cost and low accuracy. Sharp pops ring out. Acoustic receivers affixed to poles register the sound and send an alert to a command center. There, people employed by the receiver company review the audio before alerting police. Officers get dispatched to the scene to get eyes on what happened. Simultaneously, or minutes later, 911 calls might come in from residents who heard or possibly saw the source of the bangs. That's Shot Spotter, a program used by the city from 2011 until June 2026, when the city dropped it from its new budget. In the last 5 years, it has sent more than 700 alerts to city police, but officers were only able to confirm about 25% of those as shootings or shots fired incidents, according to New Bedford's police chief. That doesn't mean shots weren't fired. Some revolvers don't leave behind casings, and sometimes officers cannot find the evidence. But amid a budget squeeze, the city cited internal performance metrics to argue the program was no longer worth its cost, which was about $800,000 over the last 5 years. Some city councilors have been critical of the decision, saying it will hurt public safety. But the police chief says the program's accuracy was quite low, so it wasn't an economical use of resources. Through a public records request, the Light obtained shot spotter data from January 2021 to May 2026. The city did not provide certain data categories, claiming they would not have provided an accurate picture because they were not consistently filled out. In some areas, data cells were blank, so it is unclear what the outcome was. What is clear is that shot spotter alerts have consistently decreased. In 2021, the department received 224 alerts. In 2025, it received 99. Through late May this year, the department received 39. Shot spotter totals don't mirror the frequency of documented shots fired incidents, including shootings. According to the department, shots fired incidents were higher in 2023 and 2024 than in 2021, 22, and 25. However, some of these confirmed incidents may have happened indoors. Holly Huntoon, spokesperson for the department, in an email said, "The New Bedford Police Department cannot speak as to why the number of alerts may have increased or decreased over time." Just under 1/4 of alerts over the last 5 years were verified as shootings based on notes that officers filed after visiting the scene. Police found casings, property damage, victims, blood, and CCTV footage, the data reads. In some cases, the loud boom that receivers detected was a gunshot, sometimes multiple, but other times the boom that the system flagged as a possible gunshot wasn't. According to the data, it was sometimes a firework, an ambulance driving over something that popped, a bus tire exploding, cars backfiring, and in one documented instance, a thunderstorm. This July 4th at around 7 p.m., the department received a shot spotter alert. Despite its contract having ended June 30th, it turned out to be fireworks. Police Chief Jason Thody said during a June City Council meeting that at one point, ShotSpotter refunded the city because the program was not operating at agreed-upon standards. Huntoon said that Thody was not available for an interview. Despite extensive investigation and a review of any 911 calls, witness reports, video, search for casings, hospital checks, and other evidence, we were unable to confirm 620 or 76% of ShotSpotter alerts, Huntoon said in an email. Each of the 791 alerts were responded to with great urgency, despite the fact that only 24% were ultimately confirmed through a ShotSpotter alert, Huntoon continued. That resulted in 620 emergency calls, most often involving multiple officers, and further daylight follow-up, where there was no evidence of any shots fired. The receivers are meant to capture shots outside, not inside, and are not positioned in every part of the city. Sound Thinking, the California-based company that runs ShotSpotter, advertises itself as a security technology company that can detect gunshots in under 60 seconds, allowing a faster response to save lives. According to a promotional video from 2023, ShotSpotter was being used by more than 150 cities. Over the last decade, departments across the country have reconsidered their contracts with the technology. The Fall River Police Department ditched ShotSpotter in 2018, saying it had missed too many shootings and put out too many false alarms. A 2024 study by the ACLU of Massachusetts found that 70% of alerts by Boston Police Department's ShotSpotter led to dead ends. Thody in New Bedford presented data to the City Council saying that 911 calls came in for 76% to 90% of shots fired incidents and shootings, meaning that most of the time police are getting alerted beyond ShotSpotter. People in the city are calling to let us know there was just a shooting in this area, he said. Gonzalez said ideally he'd like ShotSpotter to stay, since it's useful for some incidents. Is it a perfect system? No. I know it does have its errors and whatnot. That argument could be made about any system, really, Gonzalez said. I know that overall for us it is beneficial when it does go off. He said ShotSpotter gave police a general idea to search for shell casings or evidence of gunfire. That's huge. Renee Ledbetter, president of the New Bedford chapter of the NAACP and director of the Shannon program, which works with youth engaged in or affected by violence, is conflicted. She sees violence regularly, including kids as young as 12 using guns, and therefore she sees the system as a tool that can assist with response times. She also worries about a bystander mentality. Some residents might hear gunshots, but assume a neighbor will call it in, or may be desensitized after hearing shots so often. But she also recognizes some people have concerns about over-policing in Black and brown communities. Ultimately, she says, now is not the time to get rid of an acoustic tool like ShotSpotter. It gives the police the ability to solve cases. That's how I'm looking at this because of the violence I see every day, Ledbetter said. So what does this mean for the state of surveillance? Last year, the city installed 20 license plate readers, cameras that capture images of cars and their plates. The camera company, Flock Safety, allows law enforcement agencies to integrate with and access cameras nationwide, enabling police in Texas to search license plate data captured in Massachusetts, for example. The city operates 249 cameras, according to the department, 7 of which are standalone Flock systems, and 13 that are city-owned but equipped with Flock software. According to NBPD, the Flock system has assisted in several crimes, including shootings. In December of 2024, the city paid Flock $81,000 for the cameras and will have an annual subscription fee of about $36,650, according to the city's public information officer, Jonathan Darling. Though it's not an apples-to-apples comparison, one system is visual while the other is acoustic and limited to shootings, this new subscription costs less than ShotSpotter. Flock systems have gunshot detection capabilities, but it requires an additional audio detection device, which the city does not use, per Huntoon. As a note, the light will report on how Flock works and what the data show with the NBPD's use of that system in a forthcoming story. If you have questions, thoughts, or concerns about the city's use of Flock, drop us a line. And in the area of health, Samaritan's South Coast will answer all 988 suicide and crisis lifeline texts and chats in Massachusetts. A state grant and a contract will expand the services through 2031. Samaritan's South Coast will soon become Massachusetts' only full-service center for the 988 suicide and crisis lifeline. The regional nonprofit dedicated to suicide prevention and crisis counseling will expand its services beyond phone calls to include all texts and chats initiated in the state and will be running 24/7 by October of 2026. The expansion is made possible through a $500,000 grant from the Massachusetts Department of Public Health. In addition, a new contract from the state will provide $500,000 a year through 2031 to continue the 988 Lifeline text and chat services. Until now, none of the 5 call centers in Massachusetts answered messages to 988, and they were instead answered by national backup centers. In 2023, the 988 number received about 17,000 text messages from Massachusetts cell phones, according to its administrator. Calls to the 988 Suicide and Crisis Lifeline routed to Massachusetts increased by more than a third from 2023 to 2025. Samaritan South Coast answered more than 1/5 of Massachusetts calls in 2025. In March 2026, Samaritan South Coast launched text and chat response pilot services after receiving the grant in fall 2025. The money allows Samaritan South Coast to expand recruiting, training, staffing, and equipment to respond to the demand for text and chat, Executive Director Darcy H. Lee said in an interview. She said Samaritan South Coast expects to grow its 60-person workforce by approximately 30%, including paid employees, student interns, and volunteers. Since early this year, Samaritan South Coast has been testing 3-hour to 6-hour answering blocks to see what time of day is busier for text and chat and will need the most staff, Lee said. Data provided by Lee reflects a statewide demand of 13,880 texts or chats from March 1, 26 to June 18 of 26. Christine Rizza, Training and Outreach Director of Samaritan South Coast, said that when the center first received the money, they were told to be prepared for only a few chats or texts a day, but that since the service went live, it is constant. It does not stop. Now that we got chat and text, I'm realizing, wow, this goes a lot deeper than the people we were reaching before, Rizza said. The training for new members joining Samaritan South Coast will remain just as thorough, Rizza said, but will be adapted to incorporate Samaritan South Coast values of listening, caring, and empathy into text and chat format. Rizza said the biggest differences in training are preparing the staff for longer conversations and adapting to texting language and shorthand. Jennifer Kelleher, Managing Director of Massachusetts Coalition for Suicide Prevention, said that while many factors can influence why there are more calls and texts to the 988 Lifeline, one is increased awareness of the number's existence. According to Vibrant's state-based monthly data, calls to the 988 Lifeline have been steadily increasing in Massachusetts since its rollout in July of 2022. Massachusetts has one of the lowest rates of death by suicide per 100,000 total population, ranking 4th lowest in 2024 with an 8.3 rate, according to CDC suicide mortality data. In 2019, the Center for Suicide Prevention reported that, in general, up to 135 people are affected by a single death by suicide, including the people who knew the deceased. For Wendy Vieira, the catalyst to join Samaritan South Coast was when she lost her daughter, Emily, to suicide in April 2018. Vieira joined as a phone line volunteer in July of 2018. I see it as an extension of Emily's heart, Vieira said of answering the 988 Lifeline calls. I see it as something her heart would have wanted. At first, she was terrified of answering the phone lines, Vieira said, but she's now grateful for it because it teaches her to be present. I'm always in the past with what happened to my daughter, Vieira said. I don't know if I would be here if I hadn't been associated with Samaritan South Coast, so close after losing Emily. She said by helping people who call the 988 Lifeline, she feels as though she can extend the help she wishes she could have provided Emily. Madison Edwards, a clinical psychology master's student at Bridgewater State University, started with Samaritan South Coast as a student intern in 2024 and is now an outreach volunteer. She entered the program because she wanted to get comfortable discussing suicide before entering the mental health profession, and she felt as though the programs in school were incomplete in preparing her for that. For her, it was important to learn to communicate with people in crisis. Edwards said she stuck with Samaritan's South Coast after her 100-hour internship because she felt its training changed how she went about her life and viewed conversations with others. Edwards recalled spending hours after her shift was over to complete a call with someone, even though it was not required. She said she thinks that text and chat will add a layer of privacy for people trying to reach the 988 Lifeline, expanding the impact of Samaritan's South Coast work. The way we engage in the world is often very transactional, Edwards said. Very rarely do we focus on the other individual. How could I go through knowing I can help people in this way and not take the opportunity to help them? The next article is on immigration. ACLU, Plymouth County Sheriff spar over ICE detainee health records. The court hearing focused on whether the sheriff's jail contract with ICE overrides the state public records law. In Boston, attorneys for the Plymouth County Sheriff's Office and the American Civil Liberties Union of Massachusetts sparred in court Tuesday over whether the sheriff must release health care records related to immigrant detainees in his custody. The hearing in Suffolk County Superior Court stemmed from the Massachusetts ACLU's records request for documents about the contract Plymouth Sheriff Joseph McDonald, Jr. renewed with U.S. Immigration and Customs Enforcement on September 25, 2024. The Plymouth County Correctional Facility is the only longer-term immigrant detention facility in Massachusetts. The ACLU sued the sheriff's office in February after several efforts to obtain records related to medical care afforded immigrant detainees there. The sheriff's denial relied on arguments about state privacy laws and questions around federal preemption of state law. We have, I think, a pretty interesting issue here, said Judge James Boudreau, who presided over the proceedings at the hearing's start. The first question is whether or not the Supremacy Clause of the Constitution prohibits the production of the documents. Dan McFadden, managing attorney at the Massachusetts ACLU, argued that it does not. Plymouth has no authority to contract its way out of public records law, McFadden told the judge in his arguments. These are records we have good reason to believe they have because the contract with ICE says they produce them. The sheriff's main argument rests on a federal regulation prohibiting the release of names of federal detainees in state or local custody and the legal theory of preemption, when federal laws supersede those at the state and local levels of governance. There's no bad faith here on the part of the Sheriff's Department, said Jessica Kenny, General Counsel for the Plymouth County Sheriff's Office. Quite frankly, providing the records could also be a violation of the law. Tuesday's hearing focused on a motion to dismiss filed by the Sheriff's Office. The ACLU argued in court Tuesday that the laws the sheriff cited were overly broad and that the sheriff was attempting to circumvent state law. It would be pretty extraordinary if Congress tried to interfere in state agencies' abilities to generate its own record, McFadden said. Kenny argued that though the sheriff could not release the requested records, the plaintiffs could attempt to procure the documents through a Federal Freedom of Information Act request to ICE. These documents were created pursuant to the ICE Sheriff Agreement, so ICE does have the records, she said. But she added that she had consulted ICE and the agency said it could not release any of the records in question. Even so, she chose to disclose 2 pages from an audit. That was actually opposed to ICE's indication to me, she said, because when I see this record, I don't see any identifying information. When Boudreau pressed Kenny on whether the redaction of detainees' names, alien registration numbers, and any other identifying information could resolve the issue, she quickly assented. If those are redacted, there's no way of connecting that to a detainee, Boudreau asked. Presumably no, Kenny responded. Boudreau said he would take the matter under advisement before adjourning. We're very pleased that the judge is giving our case careful consideration, McFadden said after adjournment. We are hopeful that the records will ultimately be ordered produced. Kenny declined to comment. There has been a history of issues with the Plymouth County Correctional Facility when they began to house immigrant detainees through a contract with the now-defunct Immigration and Naturalization Service in 1998. It is currently the only such facility to house immigrant detainees long-term in Massachusetts. According to its contract with ICE, Plymouth sets aside 250 beds at the facility for immigrant detainees. The agency pays the sheriff's office $215 per day per occupied bed. The contract also obligates the sheriff's office to create the health records. The ACLU filed its initial records request seeking those records on December 11th. The availability of medical care in immigration detention facilities is vitally important, as immigration detainees have no other way to seek medical help while detained, wrote Mackenzie Saunders, an ACLU attorney, in the original complaint. And for some, not receiving medical care can be a matter of life or death. A 2024 report published by the Boston University School of Law and Prisoners' Legal Services of Massachusetts found through interviews with detainees that Plymouth authorities did not provide detainees with necessary care and services. It recommended the sheriff ensure inmates had timely access to necessary medical care, offer free access to phone and video calls with loved ones, and to discontinue the use of solitary confinement. Another 2024 report by the ICE Office of Detention Oversight found the prison had no deficiencies in treatment. As of June 9th, 52 people had died in ICE custody nationwide since President Donald Trump's return to the presidency, according to a report by Human Rights Watch. The ACLU cited the fatalities and other reports of ill treatment in its complaint. Several of those detainees died of what may appear to be minor problems. On March 2nd, 56-year-old Emmanuel Damas, a Haitian man living in Boston, died at a hospital in Scottsdale, Arizona, while in custody from an untreated tooth infection. On Tuesday, the public learned that Mohammed Nazir Pakhtiawal, 41, an Afghan national who fought alongside U.S. forces in Afghanistan and was detained in Texas, died from an allergic reaction to an unidentified substance on March 14th. And from the State House, new error rate puts Massachusetts SNAP program at risk. A staffing reduction in the state budget bill could undermine efforts to improve SNAP payment accuracy, advocates warn. Massachusetts registered a 12.5% error rate for SNAP's benefits in fiscal year 25, which could put the state on the hook to cover more of the cost of the federal Food and Nutrition Assistance Program. The error rate, largely due to overpayments, exceeded the 6% threshold that Congress approved as part of a law intended to force states to be more vigilant about oversight. Error rates measure how accurately state agencies determine household eligibility and benefit amounts. The nation error rate is 10.6%. Meanwhile, advocates say a staffing reduction in the legislature's new state budget bill could undermine that effort to improve SNAP payment accuracy. States with error rates at or above the 6% threshold will be responsible for covering 5%, 10%, or 15% of their state's benefits as soon as October 1st of 27, according to the USDA. SNAP, a federal nutrition program formerly known as food stamps, is administered by the states and by the Department of Transitional Assistance in Massachusetts, where the program serves about 1 in 7 residents. Monthly benefits are granted on a debit-like EBT card to buy food. A household of 2 with a maximum monthly income of $3,525 would be eligible for a monthly benefit of $546, according to the state, while a household of 4 with a monthly income of $5,358 would receive $994 per month. The mass SNAP error rate was 14.1% in fiscal 24 and 11.8% in fiscal 20. The error rate was below 6% for about 20 years before the pandemic, she said. Insufficient staffing and training needs at DTA must be addressed, she said, because residents who need assistance with benefits sometimes can't reach someone when they call for help or may reach a worker who is overburdened and stressed. As a result, accuracy and access suffer, she said. Instead of cutting, the state should be increasing the funding and adding even more DTA caseworkers, Mass Budget said in a statement Wednesday. Failing to address the shortage of caseworkers is also likely to have serious consequences for federal funding moving forward. Advocates argued that increased workloads, delays in processing applications, and difficulty for clients reaching the agency by phone have contributed to payment errors. They said additional staffing, not a reduction, is needed to bring the state's error rate down. Dave Foley, president of SEIU 509, which represents the caseworkers, said they are already struggling to provide the level of support Massachusetts residents need. We urge the Healey administration to act quickly to introduce a supplemental budget that will not only ensure full support for the current workforce, but also make additional investments to hire more caseworkers, he said. Without those investments, long wait times and high caseloads will continue to present barriers for both workers and clients. Funding DTA workers is an investment in timely, accurate, and effective services for the clients who rely on them. SNAP costs $2.1 billion in Massachusetts. Negus of the Massachusetts Law Reform Institute estimated the state would be on the hook for $106 million in costs with a 5% error rate, $213 million with a 10% rate, and $319 million with a 15% rate. This is Gail reading from the New Bedford Light. Thanks for listening.